Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Sylvia Harrington from Surgical Associates of Warner Robins, and today we're talking all about fibrocystic breast changes. Welcome to the show, my friend. Nice to see you again.
You too.
Okay, what is FBC? Explain to everyone at home, because I could just get it out of my mouth.
Yes, so fibrocystic changes in women are changes which occur in women in reproductive age and are a result of the changes in our breast during a monthly cycle. The breast tissue continuously undergoes remodeling. The breast tissue cells grow and increase in size and shrink every month.
So you're saying that a woman would perceive that their breasts are getting bigger and then smaller again after menstrual cycle?
Well, there are symptoms.
In layman's terms?
During a monthly cycle, there
Right.
are some symptoms which women can normally experience, but with fibrocystic changes in about 50% of women, this normal remodeling can lead to deposits of debris in the breast, which can lead to cyst formation, pain, and of course also deposits of fibrotic tissue.
Okay, I want to ask you about the symptoms, if I may. With women sitting at home now watching you, is there a self-examination? Is it something that you can know if you have FBC?
Yes, so most common complaint is pain. It could be just a few days in a month, but it could be over a week in a month. It could be up to severe pain in the outer quadrants of each breast, and it's usually on both sides. And then, of course, women, the other main complaint is they feel that their breasts are becoming lumpy.
Right, okay. Now, if we feel those lumps, what do we do?
So if there is either breast pain or breast lumps, the patient should see a medical professional.
Okay, is it cancerous?
No.
Those lumps become cancer? We really want everyone to know at home that
No.
there is a difference, right?
Yes, this is a benign condition, but it can be very disconcerting to patients because they, of course, worry.
Women are trained to check for lumps, correct?
Right.
So immediately you think, my gosh, I've got breast cancer. We want you to
Exactly.
know that this is different, correct?
Correct.
Benign, what else?
It's benign, and the good news is, although it can be very painful at times and bothersome, usually it's one of the few conditions which improves with age. Actually,
really?
Postmenopausal females, it usually gets better and better.
Is there an operation to remove these problems, or you're just stuck with it?
You pretty much stuck with it. There are some things which we can do as far as diet and medical treatment, but pretty much the reassurance and symptomatic management is all we have to do.
What tests are you performing on the women to diagnose FBC?
FBC. So, first thing is you take their history.
Yeah.
If they tell you they have cyclical pain in both breasts, it's very usually pretty it's a telltale sign that it's a fibrocystic changes. Another thing is you'll perform physical exam that could range from normal to very tender breasts to some lumpiness. And of course, we have to do some imaging, typically mammography in women over 30, plus minus ultrasound as well.
Well, we don't want to alarm people, but you are saying that, is this a health scare? Do you understand what I'm saying?
The diagnosis of fibrocystic changes is not a health scare.
Okay. That's what we don't want people to feel at home,
No,
that this
it is not.
is a
Absolutely
life-altering issue
No.
for you. Just explain to everyone again about testing. How does one do that for themselves, sitting at home?
They have to
Yes.
contact their either primary care physician or come to our office.
Okay, so do they need referrals?
It depends on the insurance, but
Okay.
usually primary care physician should know first, and then based on their symptoms and etc., they are referred accordingly.
Right. We appreciate you. Thank you for coming in again, Dr. Sylvie. If you want
Thank
to
you
find
so
out
much for
more
having me.
information, there it all is up on the screen for you. Surgical Associates of Warner Robins. They'll take care of all your needs. Back after this short break.